Hello, my name is Mar DiCarlo. I am the founder of the International Parenting and Health Institute. I'm also the founder of the Association of Professional Sleep Consultants. I have been coaching individuals and groups in the health and wellness space for over 25 years. I have been mentoring and training professionals for the last 15 years, and my organization is now represented in 61 countries. I am so passionate about the work that I do because most people do not know their options. And when they're going through a health or parenting challenge, they will go to what they think is a trusted source to be met with one way of thinking. Maybe it's a cookie cutter solution. Maybe they're trying to promote something where there's a financial interest. The best thing that one can do to support and help another individual is to share with them all of their options. And today I want to talk to you particularly with what's happening with obstructive sleep apnea and the medical space. I have been teaching integrative adult sleep coaches since 2015, and health and lifestyle play a vital role in sleep challenges, whether they're medical or non-medical. I continue to see sleep doctors promoting medications for weight loss for people who are struggling with sleep apnea and the CPAP. And I want to share with you some compelling evidence-based information that I have been sharing with my professionals for many years to give you another insight and perspective and to help you understand what your options are. I'm not against medications. They may be necessary from time to time, but from the most part, they usually are not. And if you are to make the choice to be committed to making changes to your health and lifestyle, you will experience very positive results without the side effects and the high financial costs. I'm going to share with you a case study with the 55-year-old man who was using a CPAP for 10 years. And after making dietary modifications within 3 months, he no longer needed his CPAP. Lifestyle modifications and the resolution of obstructive sleep apnea syndrome, a case report. This purpose of this case study is to describe a natural method to help in management of obstructive sleep apnea, OSAS, which is known to be a common and debilitating condition. This report describes the chiropractic management and resolution of OSAS with dietary modifications in a 55-year-old man who wore a CPAP for 10 years. After adhering to dietary modifications for 3 months, the patient no longer required the use of CPAP device and continues to have a normal, active lifestyle almost 7 years later. And then it states dietary modifications may be an effective tool to improve the management of OSAS. I can confidently say it is an effective tool to improve the management of OSAS. And although it may not resolve every single case because there are exceptions, for the majority of cases, there will be a huge improvement. A 55-year-old white man sought chiropractic manipulative care for chronic low back pain in January 2004. He suffered from back pain for most of his adult life since approximately the age of 25 years and found that spinal manipulation modulated the pain and allowed him to maintain optimal function. During the history-taking process, the patient also complained of suffering from obstructive sleep apnea for the past 11 years since 1993. In 1998, he underwent surgery for the correction of a deviated nasal septum and to clear nasal obstruction by removing the adenoids and uvula. Despite surgery, OSAS persisted and the patient was reliant on the CPAP device from 1993 to 2003. In January 2004, patient began anti-inflammatory lifestyle modifications to pursue wellness. In March 2004, patient is 100% free of OSAS and CPAP reliance. Let's now fast forward to present day. As of September 2010, he remains free of OSAS and hypertensive medication. His blood pressure is 120/80 and his weight is 1 176. For the majority of the patient's adult life, he weighed between 210 to 260. His weight before initiating lifestyle changes in January of 2004 was 225. As of September 2010, he weighed 175 pounds, a 50-pound reduction. The patient also reported several subjective improvements in quality of life, sexual improvement with increased desire and pleasure despite decline before lifestyle changes, increased energy and stamina during activities of daily living and exercise, increased positive mental attitude and mental body image, increased optimism, increased frustration, decreased mood swings, better mental capabilities and clarity, improved quality of life and ability to pursue activities of daily living and hobbies such as hiking, backpacking, and sleeping on his lake boat, increased agility and balance, walking steep, uneven grades while hiking had improved, general increased feeling of well-being, felt more refreshed, lighter, and in tune with his body. Patient felt better rested in the morning than he did despite surgery during CPAP device use and even before CPAP use. What's happening today is now you have sleep doctors excited about weight loss medications in order to treat obesity. And when you treat obesity, it may help improve obstructive sleep apnea and the need for a CPAP device. However, when you look at the side effects of the medication, the costs of the medication, how long you have to take the medication, it makes you wonder, why is a dietary modification, a lifestyle modification, not being pushed and at the forefront of everything? And again, I am not against medications. The issue that I have with the majority of the medical industry is that before they will put forth a very natural way for a human being to invite a healthy lifestyle, they will get excited about new medications in the market that usually have side effects and one may need to rely on for a long time. So if we look at side effects, swelling, redness, itching at the injection site, tiredness, loss of appetite, nausea, vomiting, upset stomach, diarrhea, constipation may occur. Remember that this medication has been prescribed because a doctor has judged that the benefit to you is greater than the risk of the side effects. Many people using this medication do not have serious side effects. However, they exist. And even if it's a small side effect, why put yourself at the risk when you can just naturally address your body first? Looking at an overview of the GLP-1 agonists, which are a class of drugs used for diabetes and weight loss. Some of the common side effects include nausea, vomiting, diarrhea, dizziness, increased heart rate, infections, headaches, indigestion, temporary mild itchiness or redness on the skin of the site of injections. Right? And see that across the board with a number of sources. Know your options before you are convinced that medications are the way to go to treat your current situation. First, explore the possibilities of what health and lifestyle modifications can do for you, what natural health and lifestyle modifications can do for you. It is your body. It is your life. Take it in your hands. I understand that these medical doctors mean well. They're coming from a really good place. But at the same time, knowing what I know and being in the health and wellness space for as long as I have, I've also seen the downside when they stay with a very narrow perspective and don't have the understanding that I do. Take your power back, take your life in your hands, have compassion for those experts that don't know any better, and trust your intuitive guidance.